Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey guys, welcome back to another episode of Between the Sheets. I'm excited for today's topic, Peyronie's disease. It's one of my favorite things to treat as a practitioner, and it's something that's fairly common. A lot of guys end up dealing with at some point in their life, and so I think it's definitely something that needs to be talked about, especially on this podcast, because it does not only get caused sometimes by sex, but can also have some issues with having sex going forward and your ability to do so. So what is Peyronie's disease? It is a fibrous scar tissue inside the penis that causes a curved, painful erection and can shorten the length of the penis. There's more than 200,000 cases in the United States annually, so it's pretty common. And because penises vary in shape, size, and having a curve in your erection may or may not be a cause for concern. Some guys are born with a little bit of a curve. That's a congenital curve. So this is something that is happening later in life, kind of spontaneous. Peyronie's disease, the bend is significant. It can occur along with pain and it can interfere with sexual function. So the cause of Peyronie's most commonly is caused by a sex injury. So doggy style, where you're going into your partner from reverse and you don't hit the right hole correctly and you kind of bend, or reverse cowgirl, that can happen as well, where your partner is on top of you and comes down kind of wrong and gives you a bend and can hurt you. Partner facing forward on top can also be a problem, but tends to not be quite as significant as the reverse cowgirl. It happens when the penis does not go into the vagina or the anus correctly, and it has a pressure injury from connecting with the muscles or bones of the partner versus going into an opening. It can be severe and cause pain right at that time and significant, or it can be repeated small injuries over time that end up developing one of these plaques and then a curvature. It can be from other activities such as athletics or accidents, but primarily the most common is from sex injuries. And do not be embarrassed to tell your provider when you go in and get checked out for this that it happened during sex. We expect that it happened during sex. We don't expect that you just walked into a wall and this happened. Some patients cannot pinpoint a specific injury or activity, and that's okay. I mean, there's no judgment and it doesn't change how we treat you. It's just that we do like to know, exactly what happened so we can kind of talk you through the implications of it. The pain usually occurs immediately, but if it's not a severe injury, there may not be noticeable pain because you're engaged in an otherwise very pleasurable activity. Not all injuries lead to Peyronie's disease. So you may have an injury that is, so small or minute enough or didn't actually break the blood vessel to cause a plaque, and that can just be a bruise or something similar, some pain for a few weeks, but doesn't actually lead to Peyronie's. There are some risk factors for Peyronie's disease. One is family history. If a family member has Peyronie's, you have a higher risk of getting that condition. I don't know how many of you guys talk to your dads and your uncles and your grandparents or grandfathers about whether or not their penis has a curve in it, but family history does tend to have a factor in that. They are trying to figure out if there's a genetic trait, but we don't know that answer yet. Connective tissue disorders. People can have certain conditions that affect their connective tissues, which seems to have a higher risk of Peyronie's disease if they have one of these connective tissue diseases. Age. Peyronie's disease can happen at any age, but it becomes more common between the ages of 45 and 70. Curving of the penis in younger men is less often due to Peyronie's disease and is more commonly a congenital penile curvature. A small amount of a curvature in a younger man is typical and not concerning, so nothing that we would even work up. Certain health conditions like smoking and some types of prostate surgery can put you at a higher risk of Peyronie's. So what are the symptoms? Symptoms are scar tissue, so you can actually feel the plaque in most of these men. And I did bring a toy in from work, so those of you that pop over to our YouTube page to watch this episode, you will be able to kind of have a visual of what I'm going through today. But this scar tissue, it develops, and we call it a plaque. So it's a Peyronie's plaque. It's different from plaque that can build up in like your vessels and your arteries and on your teeth. Those are caused by specific things. This is a fat lump. Excuse me, flat lump, not fat lump, and a band of hard tissue. The area that covers the scar may feel tender. And this area generally no longer stretches when you have an erection. The bend to the penis, the curve can be in any direction. So it can go upwards, downwards, left, right. Sometimes they kind of go up and to the left or up and to the right. So there's different ways that it can bend, but it's a significant bend. Peyronie's disease can also have erection problems. So because you have this plaque, you can get difficulty getting the erection or keeping the erection. And you can have pain with erections as well. There are people who have noticed erectile dysfunction prior to their Peyronie's injury, and then it gets worse. So it's not necessarily always something that starts with Peyronie's, but could get worse because of Peyronie's. Shortening of the penis. The penis can become shorter during erections because of that plaque. Again, that stretch of that tissue is gone once a plaque develops, so you can get a shorter penis. Pain in the penis. This sometimes happens with or without an erection. And other changes in how the penis looks. Some people will describe it as an hourglass shape. So where the plaque is kind of this tighter area. So, the penis engorges with blood, then it has this tight area, then it gets engorged with blood again. And so that can be abnormal for somebody who's had a very normal, straight penis for many years. And then also bruising can occur. Usually pain with erection is the first sign, and then the curve and the shortening happen, and those develop over time. The curving and penile shortening are linked with Peyronie's disease. They can become worse over time. So if you don't get it treated, let's say you have a curve after 9 months post-injury and you have a curve. If you decide not to get treatment, that curve could potentially get worse. Okay. The physical changes in the penis often get worse or stay the same during the first year to the year and a half. And then the pain during erections usually gets better within 1 to 2 years. But the scar tissue, the penile shortening, and the curvature often remains regardless of whether or not the pain has gone away. And then also very not common, but Peyronie's can correct itself in some individuals. Very rarely though. That's not very common that it does it on its own. There are some psychological symptoms. Here you've had this great dick and you've been having great sex for years and years and years, and now all of a sudden you have an injury and it curves and you're not sure whether or not you can penetrate, or you've tried to penetrate and the curve is too severe to penetrate. You're dating somebody new and you're not sure how they're going to respond to this. So there can be a lot of stress and anxiety and depression over the changes in the way that your penis looks and your ability to have sex. There can be stress on the relationship with the partner if you're also having erection issues, or you're having difficulty conceiving a child because you can't penetrate. So you really want to be open with your partner, explain what's going on, how it affects your ability to have sex. Are there certain positions that work for you and certain ones that don't? And you can kind of adapt to that. Talk to your partner about how you feel about the way that it looks. I mean, that's a huge change for you. If all of a sudden our breasts looked differently or my finger looked differently, that would bother me. So if your penis looks different and it bothers you, talk to your partner about that. And then also talk about maybe other ways that you can have that physical intimacy if you're not able to penetrate right now. And certainly if you do undergo treatment and there are certain time periods that you're not allowed to have erections due to the treatment, find other ways to be growing intimacy and connection between you and your partner. And you can certainly talk to a mental health professional who is skilled in sexual relations, and they can really help you kind of work through the mental part of that as well. Okay, so you have this weird curvature or this hourglass shape. You don't really know what's going on. You're ready to go in and get it checked out. So, how do we diagnose it? We do an exam. We look at you, we feel your penis, we find the plaque. We love it if you bring in pictures when you have an erection. If you don't, we can artificially give you an erection in the office using a medication called Trimix. But pictures certainly help us to not be able to do that for you, and make a faster appointment, as well as kind of see exactly what's going on. But we will look at your penis. We will feel for the plaque. We usually can tell exactly where you're curving based on where the plaque is. And we can see how much of the scar tissue is there and how hard it is. The more calcified the scar tissue is, that helps us know which treatments we can offer you and actually get some benefit out of for you. Um, Ultrasound is also used for this. So we have the physical exam, we have pictures, we may give you an injection to get an erection and actually visually see it for ourselves the way that you curve. And then also ultrasound, which is actually going to look at the internal components and the blood flow of your penis and see where that plaque is, how large it is, and all of that. And then we can also assess your blood flow at that time to see if, let's say, you are also having erection issues. We can kind of give you a little bit of a helpful diagnosis that way as well. So treatment is pretty minimal. There's really only two that I like. But we don't have to treat this if it's not painful and it's not impeding your ability to have sex or penetrate. That's completely up to you at what point we decide to treat it. Early treatment is optimal to prevent severe curvature and shortening of the penis. There is the acute phase and the chronic phase of Peyronie. So the acute phase is the injury, the scar tissue development, the changes in the curve or the length of the penis, pain during erections. And this is usually the first 5 to 18 months where things are, they're really getting worse for you. The pain may get better during this time, but the other symptoms, the shortening, the curvature, and the scar tissue itself can get worse. The chronic phase, the scar tissue in your penis stops growing. So whatever you developed over that first 18 months is what you got. And then the symptoms become kind of stable over time. So you have no more pain, really don't have any more changes to your curvature, the length, or the hourglass shape. That all is pretty stable at this point. So this is a really great time to get some treatment. We can treat during the acute phase. The acute phase is where we would use some traction therapy. One of these really great devices is called Restore X. So what these do is you actually clamp it onto your penis. It almost kind of looks medieval like, and you bend it in the opposite direction of the way that you curve. So for the Restore X, it gives you results. You use it twice a day for 30 minutes at a time for 12 weeks. So it's a commitment. But if you get this during the acute phase, you may then prevent needing to do some of the stuff that I'll talk about later with injections or surgery. The Restore X, I believe last time I looked, it was around $500. So again, it's an investment of both money and time, but it works really well. 94% of men gain length, with the average of 1.6 centimeters or about 11% increase in length. 77% of men reduced their curvature by about 17 degrees. So that's good. If you come in with a 30-degree curvature and we can reduce it by 17 degrees with just traction, you're probably going to be able to penetrate at that point and may not need any further care. You can certainly get more treatment if you need to. 73% of men reported improved ability for sexual activity, and 100% preferred Restore X over other traction devices. So there are other ones on the market. There are some that are less expensive. I have seen some of them. Some of them are okay. Some of them you can definitely tell that you're getting what you pay for. But I do like the Restore X. There are some ways to make it a little bit more comfortable for you when you're using it. I do think that it's an option. There are no long-term complications associated with Restore X throughout their research. The treatment is not covered by insurance, but you can use your FSA or HSA money for it. There are some medications that can help during the acute phase, that either by mouth or with shots. Some of us will try giving you a daily dose of Cialis to increase the blood flow to your penis to help with healing. But surgery itself is not recommended during the acute phase. We want to wait until the chronic phase where everything has stopped worsening before we consider surgery. So let's move into that chronic phase. Excuse me. The treatments for the chronic phase may be done alone or they can be combined with one another. So again, medications, they're not really recommended in the chronic phase. They haven't been shown to be effective in kind of reversing the Peyronie's in the chronic phase. But for some guys with erection issues, that can be helpful for the erectile dysfunction. And then hopefully your curve isn't too bad that you can't penetrate. But certainly if it is, we can help with that. So there are medications that we can put directly into that scar tissue. That is what helps not reverse it, but to kind of dissolve this scar tissue and get that plaque to become minimal and get you back get you back to straight. Probably not 100% straight without surgery, but certainly can get you back to where you can penetrate. So the one that we use the most is Xiaflex. It's the best one on the market. It is FDA approved. We do like it a lot. It is expensive, so you need to make sure that you get it approved by your insurance first. And it can help with moderate to severe curvature. The lumps under the skin that can be felt. This treatment, this Xiaflex treatment, works by breaking down the buildup of the collagen protein that's in the scar tissue. So that's what causes the curve. So it breaks this down. And it works better along with traction therapy or modeling. So again, get that Restore X, get the Xiaflex, and work on straightening. Modeling is something that you can be taught how to do at home, or a practitioner can do it for you in the office. It's just kind of some stretching of the penis, again, in opposition to the way that it's curving with the Peyronie's. So Xiaflex is 4 cycles of 2 injections. So a total of 8 injections in sets of 2. You give them 1 to 3 days apart. So if you came in on, let's say today is hump day. So if you came in today on a Wednesday and got your shot, you would get your next shot Thursday, Friday, or Saturday. You don't want to go longer than that. You want to double up right away. I prefer mine every other day. So when I give the guys, it's Monday, Wednesday, Friday, Tuesday, Thursday, something like that. Each cycle is 6 weeks apart. So this is really going to happen over about a 6-month period, right? So you get your 2 shots. Let's say you came in today, so Wednesday and Friday, and then 6 weeks from now, you're going to come back in and we're going to do 2 more shots. 6 weeks from then, 2 more shots. The downside with this is you're not allowed to get erections for 4 weeks. So every time you come in for a cycle, you have a month where we don't want you getting erections. If you are still at an age and capability of your body of getting morning wood or spontaneous erections throughout the day, we just ask that you don't use them. You think thoughts that you try and get them to go away. We really don't want you getting erections during this time. We want the medicine to do its job and to break apart those plaques. So 4 weeks, the last 2 weeks, I said these are 6 weeks apart. So the last 2 weeks, you're allowed to have erections. We want you to take pictures with an erection and come back in for your next cycle. The most common side effects with Xiaflex are a hematoma, or a bruise, essentially, a small collection of blood under the skin where the injection was given, swelling at the injection site or along the penis, pain and tenderness. Obviously, we just put a needle in your penis, and it can be at the penis or just slightly above the penis on your pelvis. Bruising, itching can sometimes happen, painful erections. Again, we want to limit the erections for those first 4 weeks. Erectile dysfunction, changes in the color of the skin of your penis, sometimes blisters at the injection site. You can have pain with sex and lumps at the injection site, like a little nodule kind of where most likely a little blood clot is underneath there that you just can't see. So bruising and swelling are totally normal, but a fracture is not. So a fracture of your penis is a medical emergency. When Xiaflex was doing their research, they did a study of 832 men, and 3 had penile fractures. So it's not common, but it is something that we watch for. And it is something that we take very seriously if it does happen. What you're looking for is, because we know that there can be some bruising and some swelling, right? So that's expected. What we're looking for with the corporal rupture is looking like an eggplant, okay? Your penis is hugely swollen. It doesn't look like a penis anymore. It is very dark purple. You're probably having bruising along the whole perineum area, the front of your pelvis, maybe a little bit in your inner thighs. Your scrotum can be bruised, and you're having pain. This is a medical emergency. Go straight to the emergency room. We can't really reverse it or do anything to help you in the clinic setting. So even if you got your injection in the clinic that day, you need to go to the emergency room so that we can help you with this surgically. Okay, so again, it's not common, but we do know how to treat it if it does happen and it is a medical emergency. Some of our guys get back pain reactions after the injection, just kind of a sudden feeling of back pain moving down the legs. It's usually gone away within 15 minutes. I personally have not had any of my guys have this, but it is something that we watch for. In the clinical studies, Xiaflex was not associated with shortening of the penis length. Studies have shown that 34% improvement in the penile curvature with Xiaflex, compared to 18% improvement with men who were given a saline injection, so placebo effect. And so it really does have a significant improvement. Again, it's not going to get you 100% straight. If you come in with a 45-degree curvature and we get you 34% improvement, you're not going to be straight, but you hopefully will be able to penetrate again and have less pain. There are a couple other medications that other people use. I don't use them, verapamil and interferon. Again, they can kind of interrupt that collagen tissue formation. I don't really have a lot of experience with these. We really use the Xiaflex in our office, as well as the traction therapy and the surgery. So again, traction therapy, the RestoreX, clamp it on there, stretch it in the opposite direction, and that really helps improve the outcomes of the Xiaflex. Surgery is certainly an option. Surgery is if the curve or bend of your penis is severe and bothers you a lot, just based on the way that it looks. If it's preventing you from having sex, we want to fix this for you. Again, we don't do this early on in the acute phase. Usually it's if you've had Peyronie's disease for 9 to 12 months or more. Okay. We also don't want to do it while your penis is still worsening of the curvature. So once your curve has kind of stabilized, you're not having pain anymore, then we can look at these surgeries. There's 2 different kinds. There's called plication, which is where we're going to go in and suture the opposite side and get the penis to get straight that way. The other is a graft repair. So with the plication, if you think of your finger kind of bent as if it were the bend in the penis and you're trying to get it to go straight, you're going to suture on the other side to pull that skin tight. And that way you can get that nice straight erection again. It's generally used for curves that are less severe. And they usually have pretty similar rates regardless of which plication technique is used by your surgeon. But the success of the surgery, it really depends on, how severe your curve was and how skilled your surgeon is. I happen to work with a very skilled surgeon. He's amazing, and I have watched his outcomes, and it's just fantastic. The graft repair surgery, it is an incision or excision and grafting. So you're actually the surgeon will cut out the plaque. And then, so they actually deglove the penis. They peel the sheath back. They take the scar tissue off, straighten the penis. The graft is sewn into place to cover any holes in the tunica. So in those areas that we may have to graft to prevent this from happening again, they use your own body tissue for that. And then sew everything back up and you're nice and straight. This is for serious curvatures and the hourglass shape. It works really well for as well. And then finally, we also have, like we had for erectile dysfunction, we have penile implants. So if you are having erectile dysfunction and you have Peyronie's, you may do very well getting a penile implant that's going to, fix your ability to get erections as well as make you straight again. So we do have patients that kind of combine that together. So that works really well. It's time for my favorite segment of the show, Between the Sheet Shenanigans. We've got some great stories for you, and as always, the details of the stories will be changed so that you cannot identify who the owner of the story is. It might be my story, might be my friends or family members, or even a patient's story, but you're not going to be able to tell. Please send in your stories as well so we can shake up the details and share your stories. Send them into podcastbetweenthesheets@gmail.com. Let's tell some stories. All right, let's get into some story time. You all know how much I love my stories, and Peyronie's disease has some great stories with it. So I had a patient with Peyronie's with severe pain with erections. He had a known injury that happened during doggy style sex. We put him, so he was in the acute phase. We put him on daily Cialis, and we also had him take some NSAIDs like ibuprofen to help with the pain. He came back 3 months later and he no longer had pain, but now he had a 30-degree curvature. And we waited a little bit longer, wasn't getting any worse. So we went ahead and did Xiaflex for him through the 4 cycles, 8 injections. He had about a 10 to 15 degree curve now, and he can totally penetrate. So he had great improvement. And he is very pleased. His partner is pleased because they can penetrate appropriately now. So that was really great. One story, when you work in urology offices, everybody has stories and we are all very familiar with each other. And so we certainly tell stories about ourselves to each other as well. We had a coworker come in one day and he had woken up that morning with an erection and he had pain. And he was like, well, doggone it. Like, why do I have pain with this? So he palpated where he had the pain. And sure enough, there was a little plaque there. He did not recall a sex injury. But he is very sexually active, and so it's possible that happened. So he didn't have a plaque, or he had a very, very tiny plaque, but no further pain other than when he had woken up that morning, no curve, started daily Cialis, and about 3 months later, he went ahead and stopped it because he had no curve. And this has not impacted his erections or his sex life. He did not get ED from this. He does not have a curvature. He's still having some great sex. We had a patient with Peyronie's plaque for about 3 years, and the curve finally got to the point that he couldn't penetrate effectively anymore. And so we did 4 rounds of Xiaflex, and he had very minimal improvement. He was still not able to penetrate. So he did the plication surgery, and he got to 100% straight. He had very minimal loss in length, and he is very, very happy now. We have patients coming in and asking about the carrot commercials or the couch commercials. These are put out by Xiaflex. They're great conversation starters for patients who have no idea what the heck it is and why they all of a sudden have a curve in their penis. They'll say, they're coming in for their annual exam for something else, and they'll say, I saw this commercial with this crooked carrot, and they were talking about it being a penis, and like, my penis looks like that. And like, what do I do about that? What is that from? And so it's a great conversation starter. I appreciate those commercials being out there. I had a patient with ED and Peyronie's disease. And one of the best things about being in urology is, and sexual health, my patients tell me everything, right? I know if patients have husbands, wives, girlfriends, boyfriends, multiple people, what kind of sex they like, they tell me everything. And so this particular person had a wife and a girlfriend, and they did actually know about each other. I have situations with patients where they don't, but in this case, they did. And so he had a curvature, and he also had erectile dysfunction. So we started the first round of Xiaflex, and he was like, absolutely not. I am not doing this again for 4 times. I am not going without erections for a total of 4 months over the next 6 months. I need to have sex, and I need to have sex with multiple people, and I need to keep many people happy. And like, this just isn't going to work. So he ended up opting to have the plication surgery and get a penis pump at the same time. And that worked great. He is very straight at the end of surgery. His penis pump works fantastically. He doesn't even see us anymore because he's successful and doing well. And so that was really great. All of his partners are happy, and everybody's doing well there. So just some really great stories with Peyronie's disease. We absolutely can help you with this, and it is fairly common. So if it happens to you, don't be shy. Go to your provider. Let them know this is going on so that we can get you on the path to getting back to being straight. Have a great day. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.